Hi, my name is Michael Domansky, Senior Physiotherapist at MD Health. I'm going to talk to you today about probably the second most common reason we see for hip pain, and that's a tear in the muscle of the side of the hip. It's often called trochanteric bursitis or hip bursitis, and it's more common in women than it is in men, but it is due to a tear in the muscle of the side of the hip called either the gluteus medius or the gluteus minimus muscle. Those muscles come together into one spot, so they share a common tendon, so it can be a tear in either one of those two muscles. It's often felt at the side of the hips here and can radiate down the sides, sometimes all the way down to the sides into the feet. There's two particular things we can do about this. Number one, it really depends on what you do at home. So the most common thing is lying on your side in bed, particularly if you've got a soft mattress, lying either on that side or the opposite side. Either one of them causes the legs to come inwards and it puts that muscle on stretch, so it hurts. What you can do about it at home is sleep with a pillow between your knees. So if you start to feel that kind of pain at the side of the hips, you put a pillow between your knees and it will make that sensation go away, even in that night, it will make it go away. So that's a very important step. So in managing these kind of problems, it's 50% of what you do in the positions you're in, and about 50% of making the muscle stronger. So that's the first thing. Sleeping with a pillow between your knees makes a big difference in this pain. The second one is to work on the muscle side of the hips. We're going to start with that today. Now, to do this one, you need a belt. So when we do this one in the clinic, we use one of the belts because we need something rigid to push against. It doesn't work with something soft. It has to be rigid. So I'm going to use one of my belts, tying it up so it's fairly tight, and putting it around my knees. Legs apart, so there's some tension on that too. Shoulders back, tummy muscles in. From there, you're going to push out to the side against the belt. And it doesn't look like much, but I can feel tension here and these muscles around the bottom. I'm going to hold it for 10 seconds, and that's really important. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. There shouldn't be any pain or very little pain doing this. So it shouldn't feel more than, like I say, about 2 out of 10 of pain when you do the exercise. You repeat that again 10 times. And then as you get better at this, the amount of time you do the exercises for is longer, and probably slightly less repetitions, but it's held for longer. Each time there should be any pain doing this, or no more than a 2 out of 10. Now this may not be the right exercise for everybody. Ask your instructor when you're in for your next session, if this is you, what you should be doing, and they can tell you the best time frames to do these exercises. These are the major exercises we do for this lateral hip pain. It's called GTPS, or trochanteric bursitis, or hip bursitis. There's many names for the same thing, and we're aiming to make the muscle side of the hip stronger in order to allow it to heal so that you don't get this pain. Thank you.